Okay, hi. We're going to talk about ischemia is most common cause of back pain. By the way, you won't find this in any textbook, okay? One of the things I do is I'm a neuroradiologist. I used to run a spinal injection clinic. And when you start getting to the more advanced levels of thinking about disease, a lot of stuff is not in the textbook. And a lot of stuff, the textbooks are wrong. I tried to get this published in a research journal. I wasn't able to get it published, and it annoyed me because this is exactly true. Show this to any doctor you know who works with a lot of spine patients, and they'll go, wow, that's right. Okay, ischemic spine is most common cause of back pain. This is a book I wrote. I see tons of spines. I used to run a spinal injection clinic. I know what I'm talking about, books. I got like a 99% on my diagnostic radiology boards, and I was told unofficially I'd gotten a perfect score on my oral boards. I'm not allowed to tell you officially. So, and I've seen thousands of these, thousands. This is so common. This is the most common cause of back pain, and it's the most common cause of an abnormal spine MRI or CAT scan. Okay, I see this all the time. All right, so what are we talking about here? Young people, let's say 35 and younger, young adults, they'll often have back pain because they have a muscle strain. They don't even need an MRI. They might have what is called a Schmorl's node. That's when the disc herniates into the vertebral body. Maybe the bone's a little soft. They'll sometimes get a herniated nucleus pulposus. A disc is like a jelly donut. The nucleus pulposus is the soft part in the center. The annulus fibrosus is like a steel-belted radial tire around the soft center, which is kind of like a jelly donut with the soft stuff in the middle being the nucleus pulposus. That can herniate posteriorly. Here it is just coming straight back. That's called a protrusion, meaning that its height is the height of the disc space between the vertebral bodies. It doesn't go above or below. This is called an extrusion. It goes above the height of the end plate right here. So this is almost like a code language with speaking to neurosurgeons. When you say protrusion, that usually means it's less likely to need surgical treatment. When you say extrusion, that means a bigger disc herniation. And disc herniation is often abbreviated HNP, herniation of nucleus pulposus. That indicates it's a bigger disc amount of material has been sent posterior into the central spinal canal, and it's more likely to need surgery. And again, a lot of these patients don't need surgery. It depends on how tight their canal is. They'll have a developmental anterior-posterior diameter, and some can have severe central stenosis due to a relatively small disc protrusion. Other ones can have a big disc extrusion and their canal is so wide that it's not causing much of an effect. Sometimes over time that disc will be reabsorbed. Okay? So what am I getting at though as the most common cause of back pain? I'm talking about middle-aged and older patients. They'll often have multi-level disc space narrowing. See how this disc is narrowed between the two vertebral bodies? And it'll be narrowed because it's failed due to lack of blood supply. So this is the abdominal aorta, runs right in front of the spine. These are the lumbar arteries, and they'll often get a lot of atherosclerosis on the posterior wall of the abdominal aorta, and it'll narrow or completely block the lumbar artery going to the vertebral body. The bottom and top of the vertebral body are called end plate. Like if you look at your fist, you know, the growth plates of a long bone, those are called apophyses. And so the end plates are called apophysial equivalence, meaning that they come from cartilaginous bone. Cartilaginous bone has less blood supply. So even under good conditions, you don't have the greatest blood supply to these end plate. When you stenose or occlude this lumbar artery, the end plate will often start to become ischemic and fail and become eroded. The disc will fail, meaning that the annulus fibrosus will crack, and then the nucleus pulposus, soft jelly donut material, can start to herniate out. That can lead to protrusions, extrusions, and just simply loss of disc space height. Normally that disc, let me show you a sort of a more dynamic illustration. Normally that disc, let's say these are two vertebral bodies. The disc supports a lot of weight and makes it easy for the person to bend side to side, bend forward, bend backward, whatever. And when the disc fails, now these two adjacent bones, they have to support a lot more weight. And they'll often be slipping and sliding between these, okay? The spine has a lot of proprioceptors to sense abnormal motion. Abnormal motion, two vertebral bodies in their disc are called a segment. So abnormal motion between these vertebral bodies when the disc fails is called segmental instability. The spine, the old joke is a fox has many tricks. A hedgehog has only one trick, but it's the best, roll itself into a ball. The point being is, what does the spine do? About the only thing the spine can do is lay down calcification, and it'll try to fuse these segments. We can draw that in. So the spine will form bone spurs. And let's say this disc has failed here. The spine will start to form bone spurs that grow towards each other. And when this disc fails, now the adjacent level has to bear much more weight. So this level will start to fail. And then these two bones will form bone spurs that grow towards each other. And eventually, the entire spine will have these bone spurs fusing the vertebrae together. They'll even get bone fusion across the disc space. Okay? So these anterior bone spurs are called DISH. It means diffuse idiopathic skeletal hyperostosis. They're called bridging osteophytes. Osteophytes is a fancy medical word for bone spur. The smaller, thinner, more vertical ones are sometimes called syndesmophytes. And you gradually end up with the entire spine being fused. And this is a typical older person that walks with a walker real slow and hesitant. And then because they're in back pain, they don't exercise much. All their muscles are atrophic. They fall over and they fracture their spine. Chalk stick fractures. A lot of old people break their necks and, or fracture the thoracic spine, end up paraplegic. It's really an unfortunate thing. Plus, a lot of these old people, they're in terrible pain. They're in agony, okay? And there's not much you could do. The reason is every single level of their spine has got a degenerated disc and it's fused by osteophytes. What are you going to do? A surgeon can't remove their whole spine. They could fix the most severe level. But what I'm trying to say is, what's the smart move? The smart move is maintain good blood supply to your spine by avoiding all the atherosclerosis risk factors. Walk around a lot. When you walk, you maintain the muscle tone and you increase nitric oxide vasodilator. That is released in response to walking, activity of the muscle. So to get blood supply too, when you walk, you kind of milk the disc. The disc is alive. By the way, this disc it doesn't have any blood vessels, but it gets nutrients from the end plate by osmosis and diffusion. So it expels its waste products and nutrients come into it. The disc runs on anaerobic glycolysis, so it is alive. And what happens when you walk, it creates a milking action to get the nutrients in and get the waste products out of the disc. Walking, we're designed to walk all day. Think about, what did your ancestors do 10,000 years ago? They walked around all day looking for some food. In the daytime, slept at night. All right, let's see, what else can we talk about? OPLL, ossification of the posterior longitudinal ligament. All right, what that means is you can fuse this posterior longitudinal ligament back in there. And if you read the books will say something stupid like, OPLL is a rare disease found more often in Japanese people. And that's absolute nonsense, okay? I see it every day. All right, it's caused a traction phenomenon. Just like you fuse anteriorly, you'll sometimes fuse posteriorly. It occurs right along the disc. And that's what I'm saying. When you get good at a field, you learn to look at the textbooks. Yeah, they're helpful, but don't take them too seriously. If you really know your field, the textbooks are kind of a joke, okay? All right, what else? Foraminal stenosis. You'll form these bone spur osteophytes going into the foramina. That'll cause foraminal stenosis. That can impinge upon a nerve going out to an extremity like a root. That's called radiculopathy. Compression of all the nerve elements in the central canal can compress multiple nerve roots of the cord itself, and that's called a myelopathy. All right, let's see what else here. Tapered autofusion, a surgeon will just fuse one level. A tapered autofusion means the spine fuses all the way up, top and bottom. All right, that's pretty much the concept. So what does it mean? What's the significance for the individual? Try to maintain good blood supply to your spine by avoiding all the atherosclerosis risk factors and exercise a lot, and do these things in addition to whatever else you're going to do for your spine, your epidural, steroids, or surgery and all that. And a patient should have this in mind because it's one more thing they can do so they don't end up like these typical old people walking around in a walker or a motorized wheelchair, so sick and fragile. And so just being aware that's what's happening in your spine at every level. And by slowing down atherosclerosis, you can slow down the progressive destruction of your spine.